Hello and welcome to another Health Essentials podcast. I'm John Horton, your host. In today's fast-paced world, the wait to absorb vitamins and minerals after swallowing a pill is just too long for some folks. So to speed things up, they're going a different route. IV vitamin therapy, where a needle prick and steady drip delivers a high-dose cocktail of nutrients right into your bloodstream. This approach has taken off as a wellness trend in recent years. Of course, it has raised some questions too, which is why we asked functional medicine specialist Melissa Young to join us today. Dr. Young is one of the many experts at Cleveland Clinic who pop into our weekly podcast to chat about interesting things people are trying to boost their health. Now let's find out whether the benefits of IV vitamin therapy might make it worth getting poked. Dr. Young, so glad to see you again. It's always a good day when you stop by.
Oh, thank you for having me again. We always have a good time and hopefully are informative as well.
Well, they always are informative, and we have covered some pretty interesting topics during your visits here. But today's on IV vitamin therapy, it might be near the top of the list for me. I got to say, I'm stunned by how much this has taken off in the wellness world.
It has. I mean, IV vitamin therapy has just exploded. It's also, I think, growing in popularity alongside the wellness industry. Different things driving that are definitely the consumer and increased consumer health awareness, much more like steep rise in chronic disease. And then people are looking for preventative approaches, more holistic approaches to medicine, root cause medicine. So I think that's part of that, growth that we're seeing.
Yeah. Well, let's dive in. And I guess for starters, for those who aren't familiar with IV vitamin therapy,
Mhm.
can you give us a basic rundown of what it is and how it's being used?
Sure. And so, I mean, most simply, IV vitamin therapy is using these IV vitamin drips that deliver direct nutrients like vitamins, minerals, antioxidants, as well as hydration, so fluid, into the patient's vein. So it goes, pretty quickly into, cellular use rather than going through, we take oral vitamins and has to be absorbed and takes a little bit longer. And there's issues related to absorption, which we can talk about for some people. So it goes right into, your bloodstream and into the cells.
Now, I thought I remember when this first started off, it was really used a lot as kind of like a hangover cure. Is that kind of one of the things that kind of drove this, and now it's kind of expanded on?
Well, actually, some of the origins of the IV vitamin therapy are from John Myers back in the 1950s. He created the Myers cocktail, which was this combination of minerals and B vitamins to help with energy and mental clarity. So that's kind of the origins. But I mean, I think one of the iterations of its use has been to help with hangovers. And even though, there's nothing that's going to cure a hangover, certainly potentially hydration and maybe some nutrients might help some,
Yeah.
but it's not a cure.
All right. Well, yeah, the only cure is not drinking at all. So that's, at that point, you're a little too far past that. But as far as then just the wellness part, what are kind of the benefits there, and like why do people embrace that approach?
So I think there's a lot of claims about IV vitamin therapy, and there are some studies. There, no definitive proof, and we're still looking for high quality studies. But it can help boost immunity. It can improve energy, potentially mental clarity. Some athletes or people who really are very active are finding it might be helpful with fitness recovery. So I think those are some of the key areas in terms of the wellness focus that people are, looking for IV vitamin therapy.
This is going to be a silly question, but I mean, is there kind of like a recipe that goes into your IV vitamin bag? So like you might go in there and say, "Hey, I'm looking for this energy boost," and you get,
Mhm.
the zippy bag, as opposed to, I'm looking for immunity, and I'm going to get the don't get sick bag. I mean, can they adjust it that much?
So, yes, I think there's ways to focus on what someone is trying to accomplish at a particular time. And so there's, iterations of that Myers cocktail, and then there's been expansion since there. Like you were saying, focus on immunity for, particular person and particular day, energy. So, more or less of some of the nutrients, vitamins, or antioxidants for that condition. Yes.
Now, and I'd imagine too, like you had said, there's the speed of getting these vitamins and nutrients in your
Hmm.
system is just way
Right.
faster if
Hmm.
you go this route, correct?
Correct. And obviously there can be pros and cons to that. But I think for, most of the people who are, say, doing this generally for wellness, I think, or, very common things that people are searching this out for is, fatigue is a big one. So, I think there could be a benefit to, getting that, bypassing the gut and just, really going right into the cells to help with energy production.
Well, and I'd imagine too that the dosage, you kind of you can be a little more accurate if you're putting it right in, as opposed to putting it into your, like I said, your gut and that whole digestive system, and
Mhm.
you don't quite know what's going to come out of that.
Correct. I mean, depending on, digestion and absorption, you may not get all the benefit of the dosing of an oral nutrient that you take. And, we certainly can talk about other reasons we might want to use IV vitamin therapy, but definitely, digestion absorption issues, that fast absorption, utilization, and, we can appropriately use higher doses of some of those nutrients if needed.
So it sounds like the pros list here, we're gonna, get our ledger set up, is that you can
Mhm.
maybe boost your vitamin intake.
Mhm.
You can get a very accurate dosing by doing it this way. The
Mhm.
absorption is way quicker, so you kind of get an immediate boost or effect.
Mhm.
And it's just kind of helping with fluid intake. Is there anything else that we're kind of missing there?
Well, I think those are the main, benefits, in supporting immune health. But I think it's important to know some of the reasons, in addition, say, just to wellness, that we might use it. Most people are not aware that in the US we have population-wide nutritional deficiencies and insufficiencies. We're seeing a lot of imbalanced diets for many reasons. We're busy. We don't always get all those, the protein and fruits and veggies in that we should every day. But I think it's interesting. I see in my practice a lot of digestion absorption issues, which can be related to dietary restrictions relative to food sensitivities, or, very specific diets like vegan diets. It's important to know you can have a very balanced vegan diet, if you're working on that. So it's not like you have to have an IV with these specialized diets. Also, gosh, as we age, there's age related changes in absorption of nutrients, genetic variants in need for nutrients, and I'm seeing more and more GI disorders. So things like celiac disease, inflammatory bowel disease are going to impact how well you digest and absorb your food and nutrients.
So if you're doing this as a true wellness thing, because you
Yeah.
want to get these nutrients in and these
Hmm.
vitamins, how often do you need to do it? Because it seems like it's a
Yeah.
rather immediate effect. And I don't know if you want to go do this every day. So like, how often do you need to do it? What's kind of the timing here?
Usually, a series of IVs is probably going to have the sort of best effect if we're using it for things like fatigue and headache and muscle cramps, things like that. I have seen people with one IV really have improvements and don't necessarily need further treatments. But usually it's a series. And it's one of those things as well, it's important to know it takes about an hour.
Oh,
So
wow,
you're going
that
to be
long.
sitting for a little while. Yeah.
Yeah.
But, I think certain conditions like fibromyalgia and chronic fatigue syndrome, and there have been some studies a little bit mixed in the literature, but some have shown some benefit. These are conditions that we don't have a lot of great, treatments for. So, it's not unreasonable for some to explore whether this might be helpful.
Yeah. So it sounds like then you're saying like a series of them. This isn't something you would do where you're going to schedule it monthly or weekly, for long term.
I'd say for most people that's an option for some, depending on their goals. So, some people have chronic health issues that they do see, symptomatic benefit with a regular treatment, and they might do something, once a month. Some of the drawbacks that, we should talk about is the expense. So these are expensive. They can run anywhere from $150 up to some of these specialty drips, like, for NAD, more longevity and energy production in the cells can, be $800 to $1,000.
Wow.
So these are not things that the average person is going to be able to do, like, as you said, on a weekly basis.
Yeah, well,
It's
definitely.
maybe
Yeah,
a
you
series.
you can count. I was going to be out anyway because of the getting poked. But to be honest, if it's $800 a pop, then that's gonna do me in too.
Yeah.
Um, that seems like a pretty big con. And I know we've kind of been talking about the pros, and
Yeah.
I've been doing this podcast long enough to know there's always that other side of the ledger. So what are some of the cons to this sort of treatment?
Well, I think an important one is with all these kind of almost IV clinics or IVs as part of spas, there can be lack of regulation and oversight. So I think it's important to, ask good questions about, is there a medical director? How closely do they oversee? The formulas, oversee the administration of the IVs. I still think there's somewhat lack of medical evidence for efficacy. I think we always want to look at the, balance of medical literature and medical evidence with the clinical response we might see. So, talking with your medical provider to balance that out for you and decide if that's appropriate is important. But we also think about, we have to, some people need to be cautious of receiving too many or too much in the way of IV fluid. So patients with cardiovascular disease or kidney disease, as usual, we always want to be more cautious and avoid in pregnancy. And too many, too high a dose of vitamins over too long a period of time can lead to toxicity. So, it's not, because it's natural doesn't always mean it's benign. There's remote risk of infections at the catheter site, remote risk of these emboli, so, we have to be aware of the possible risks and make sure we're choosing the right site to have these done, and checking with your medical provider. And it may be an integrative or functional medicine provider with experience in this area. Is this right for you?
Yeah, and I was going to ask, is this something that's available at like hospitals? I mean, can you go in there and have it done? It seems like it's often talked about as more of these kind
Mhm.
of side places that,
Yeah.
they're little wellness clinics that kind of pop up and might not have the, like you said, the medical background that you might
Sure.
want to get something like this.
So, not typically offered in the way we've been discussing it at hospitals. I do know that, say, Migraine clinics are going to be more apt to offer, say, IV magnesium for the migraine and headache patients, but not in the way we've been talking about, where we're focusing on, say, just, patients may have fatigue, they may have headache or asthma that may be benefited from these IV vitamin drips, but it's not covered under insurance for the most part, and it's going to be a private clinic.
Now, I'm sure there's people who swear by these, as you always see with these sort of wellness trends.
Yeah.
But it does seem like maybe people should have a little bit of caution going into it. I mean, you're putting something right in your bloodstream, and that always should kind of raise
Yes.
some red flags as to what you're doing.
Absolutely. And, in working with patients for a long time, people also have different sensitivities, and we're thinking about even things like antioxidants, glutathione, vitamin C that we're giving intravenously. That can affect people differently. And, you want to be working with a clinic, again, overseen by a good medical director who knows to start low and slow with dosing. So it's really important that you're checking with your medical provider about whether this might be appropriate for you, and then finding the right location that has good oversight.
If you go and ask your doctor,
Yeah.
whether this is a good idea, I mean, it sounds like that's one of those. It's going to be hard just to give a yes answer, because there's so many unknowns
Sure.
when you go in there, and what's in the bag, who's giving it to
Right.
you, all of that.
Yeah. And I think there's levels, like you said. So I think the average primary care physician probably won't have experience in this area. Your functional medicine physician, your integrative physician is going to have usually more experience with the use of this, who it's going to be more beneficial for, what precautions to use, and may be able even to refer you or recommend a local clinic that they know does an appropriate job in overseeing those IVs.
Yeah. Well, and from what you said before too, it also sounds like there are certain groups who should really maybe avoid this. Like if
Yes.
you have a heart condition,
Yeah.
what are some other groups that might want to stay away from it?
So definitely, certain types of heart disease, high blood pressure, you just have to be cautious. Pregnancy, you want to be careful if you have chronic kidney disease. And the other piece is, people who are on medications, there can be interactions with, some of these higher dose vitamins that are being used. So you want to make sure it's appropriate for you, and always be cautious. People think because things are natural, that there's no potential harm, and that's not true.
So if you go to one of these establishments that are doing it, and you start bringing up hey, I'm taking this medication or that medication, and they don't have great answers, should you take that as a hint that maybe you should pass on it?
Yes, absolutely. And, always be an advocate for yourself. If it doesn't feel right, you're asking them about their medicines, your history, and you're not getting a very concise answer that makes sense. I would say, that's not a, time to leave,
Yeah.
and reconsider that.
A lot of times, do people kind of turn to this sort of therapy just because they feel like they're maybe out of options, or they're just looking for answers to like fatigue or something else, where
Yeah.
they can't seem to get over a hump?
I do think so. I agree with you there. I think there's the group that really is, trying to look for optimal health and feel the best they can be, and they're active, and, they want to, can they do even better, in
Yeah.
terms of their health? And then there's a large segment of the population who, they just, they've tried different things, and they're not necessarily working. They don't feel well. And they're looking for something, can that be helpful in helping them feel better and, improve their health?
So kind of taking all the stuff that we've talked about, because we've kind of talked about some pros you
Hmm.
might get from it. We just went over a lot of cons,
Yeah.
to be honest. So when you kind of break it all down, I mean, is this something worth trying?
I think it depends on the individual and it depends on your health issues and do you have a reputable location to go try this. So, as we had talked about a little before we started, I have some personal and clinical experience in this area. And again, we have to remember some of the limited data. But I know for me, if I'm feeling run down or I feel like I'm coming down with something, I'll go and get an IV drip and some vitamin C and some vitamins. And clinically, I've had good responses. So it's made a difference for me in the more functional integrative world for patients in some of the categories that we've been talking about. Clinically, I've seen some benefit here. So I think it's that balance of working with that provider who has the experience in this modality and working with patients. Is that appropriate for you? Is it safe? Guiding in the type of nutrient, bags that you're going to get. I think there has some clinical efficacy, but I worry about the average patient who doesn't have any of that guidance, is not working with a functional or integrative doc with experience, who, doesn't necessarily know what they're getting into.
Yeah. Well, and it sounds like you should absolutely not use this as a substitution for maybe a prescribed treatment.
Absolutely. I think that's most important. I always talk to my patients about the best of both worlds, and also keeping people safe.
Yeah. Now,
Yeah.
now you mentioned that you've done this and that
Mhm.
you've seen some benefit from it.
Yep.
So if somebody was going to try this and and give it a whirl, what
Mhm.
are some things they should look for afterwards? Like that, it's working, or
Mhm.
B, and maybe this isn't the thing for me.
So, what you look for is, did you get a little boost of energy, a little mental clarity? Sometimes that can come as you're actually getting the IV. Sometimes it comes a day later. Sometimes also a series of a couple makes all the difference. And, some of that benefit can last. But I have also experienced personally and with patients where too high a dose was started. It was pushed, the IV was pushed a little too quickly, and you don't feel so well. So you can have some nausea or dizziness. And so, that's where we know either we don't want to do that again, or it really needs a big adjustment in dose and how quickly the IV is allowed to run.
Yeah. Is there something people should look for when they're looking for a place to do this, like some sort of accreditation, or is it just kind of a gut feel when you walk in and you look around and talk to the people there, whether or not this is a reputable place?
To my knowledge, there's no accreditation yet, maybe,
Yeah.
but referrals from your integrative functional physicians can be helpful. Looking for a clinic that has a physician that is truly overseeing patient care, whether it's appropriate for you to receive these IVs, what the IVs should be. Hopefully they are, checking blood pressure and your vitals, meaning your pulse and blood pressure and breathing rate, before, during, and after those IVs. So medical oversight, I think, is really important. Common sense, make sure it looks clean, make sure everyone's had their blood taken. They are going to wipe the area with alcohol, make sure they're doing those proper things that you would expect.
Yeah. No, that all makes total sense. And it really sounds like you should trust your gut when you go into one of these places as to
Yeah.
whether or not it's a place where you want to have this done.
Yeah, I agree for sure.
So bottom line then, and looking at all this, then what should people think if this comes up?
Mhm.
Is this something you should look at doing? Is it just a personal choice, and you just got to make a determination on your own? What's your elevator speech on this?
Sure. So, I mean, I think we have to remember that for the average person, we have to go back to the basics of good nutrition, sleep, stress management. Those are that you can't have health without starting with that. So without that, you know, um, even the IVs are not going to make a big difference.
It's
I
not
think
magic. It's not going to
it's, yeah,
solve all your problems.
absolutely. I think for the patient who has the finances to explore it and is looking to either improve health or, most common things are boost immune health, to help with energy and mental clarity, and they have the okay from their doctor. I think it can be worth exploring, but don't forget those basics, because most people want to bypass the basics to go to the fancy stuff.
Yeah, yeah.
Does that
Well,
make sense?
it does, and I got to be honest. I'm probably more of a basics guy. The needle part does me in.
And a lot of people don't want those IVs. You can
Yeah.
get bruising at the site. It hurts going in, but usually once it doesn't hurt. But you've got all those little subtleties. Yeah.
All right. Well, Dr. Young gave us, as always, a lot to think about, and it really is just an interesting topic. And I
Yeah.
appreciate you sharing so much with us.
Thank you so much for having me. It's always a pleasure.
While pumping vitamins and minerals directly into your bloodstream may sound efficient, uncertainties remain about IV vitamin therapy. Talk to your healthcare provider about whether it's something you should consider before taking that needle. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.